Welcome to Substance Abuse Treatment and Group Therapy, brought to you by allceus.com, your one stop for unlimited CEUs for 12 months for $69.99. Group therapy has many advantages. It allows you to provide useful information in a cost-effective manner to multiple clients at the same time. It's also a place where clients can experience peer support as well as peer pressure to do the next right thing. It allows group members to observe one another using different coping skills and allows them to discuss different coping skills, what's worked for them, what might work in certain situations. It allows the group to provide feedback to each other, which often carries a lot more weight coming from their peers than when you, in an authoritative position, start providing feedback to them. Group therapy can also help clients overcome past harmful relationship experiences, because in a group, it's like a little microcosm, and the participants have to form some sort of relationship. They have to learn how to communicate. They have to learn how to listen. They have to develop some sort of empathy for one another in a well-functioning group. And many times they also have to learn how to say goodbye. And these things have often been thwarted in our clients' lives outside of group. Group therapy also provides the opportunity for clients to learn or relearn social skills, such as effective communication, punctuality, not interrupting, effective listening, and how to appropriately express frustration, anger, or disagreement. Groups are effective at adding structure and discipline into a client's life because it provides a time when they're supposed to be somewhere, something that they're supposed to do, and it instills hope that something good can come out of the future. And some groups are available to provide support outside of the group setting. And this depends somewhat on your agency, whether you encourage people to have contacts with one another outside of group. But whether you encourage it or not, especially in the substance abuse community, most of your clients are going to run into each other and hopefully have positive relationships outside of group at meetings, etc. There are many different types of groups. Your psychoeducational groups are just what they sound like. They provide education about psychological issues. They help them understand what addiction is, what depression is, what anxiety is, the different medications and treatments available, communication skills. Skills development groups can also teach communication skills. And they also teach skills such as anger management, interviewing, finance management, those basic activities of daily living that the client may need help with. Cognitive behavioral and problem-solving skills are much more focused, and they help the client identify stinking thinking. They identify problems in the way the client views the world, or bad thoughts that they may have, irrational thoughts that they may have. And it helps them develop more rational thoughts and helps them develop effective problem-solving and coping skills. Support groups provide just what it sounds like, support, often from peers, and it has the effect of creating sort of a new family, a place where the person can go and hopefully be real, even if they can't be real in their family of origin. Interpersonal process groups help people focus on their relationships, how they interact with one another, not only how they communicate verbally, but also their nonverbals and things they do in the relationship which may benefit them or may set up self-fulfilling prophecies and create a situation where they get pushed away or they keep recreating the same dysfunctional relationship over again. Two other types of groups which deserve mention are relapse prevention groups and specific purpose groups. Relapse prevention groups are designed to work with people who have made it through the stages of recovery and they're in maintenance. Sometimes you can introduce relapse prevention when they're in the action phase of change. And this is when you want to help the client identify the triggers for relapse, identify things that they can do in order to prevent relapse. And then your specific purpose groups are going to be tailored a lot towards your specific population. Depending on where you live, the particular population of clients that you work with, there are going to be a variety of different specific purpose groups. If you're working with young mothers, then a parenting group may be one of those. Job readiness, interviewing skills, finance management, even things as simple as health and nutrition and maybe even cooking can be helpful, because not only does it teach a basic skill that the person needs to survive independently, but it also empowers them by giving them new skills, providing a success for them, and if it's happening in a group setting, it helps them learn how to communicate with other people effectively in a non-threatening situation. Psychoeducational groups are usually used in the early stages of change, pre-contemplation, contemplation. It provides information about the disorders not only to the client, but to the family. And you can do straight psychoed groups where you stand up and do a dog and pony show and you lecture at them and you talk at them for 30 minutes, 50 minutes, an hour, please no more than an hour because most of them are dozing off. Or you can make it interactive and interesting. You can have it set up so people have to interact with one another, maybe just the person next to them. You can do an icebreaker. You can have people share different things and then group them based on similarities that they have. When you're presenting information, you can present questions and have them form teams and try to solve the question. Have them discuss in groups of 2 or 3 how they might solve the problem. If you're presenting information on coping skills, you can present the coping skill and then give each team of 2 or 3 a situation, have them apply it, or ask them, each person, to come up with a situation in which they've either used that coping skill or a situation that they've encountered that probably would have turned out better had they used that coping skill, and then have them explain how they would use it. The most effective way to do a psychoed group is to appeal to all learning styles. And people learn visually, they learn by hearing, auditory learning, and they also learn by doing. So if you can incorporate all 3 of those in everything that you do in your psychoed groups, you're going to have much greater information retention from the people that you're working with. Visual. Have handouts or PowerPoints. Nothing too involved. You don't want them too busy reading something and not paying attention to you. Let them take notes. That's helpful for some people. Auditory. Even if it's already written up, explain it, elaborate on it verbally so the people who learn best by hearing something hear it from you. And then kinesthetic, manipulative. Have them apply the situation, apply the skill, discuss it in some way, or apply it or work with it in terms of a scenario. When people do all 3 of these things, the research shows that they internalize the information much better than if they just do it one particular way. There are a variety of different types of psychoeducational groups. Pharmacology, addiction theory, relapse prevention, the addicted family, mental health awareness groups, and coping skills and defense mechanisms. One of the ones that we had the hardest time getting people to really be involved in was pharmacology, because they were either bored out of their mind or they were being triggered by hearing about the drug. So pharmacology is one that you need to be creative in your application. You have to ask yourself, what does a recovering addict really need to know about cocaine, about marijuana, about benzos? They don't need to know all of the half-lives and this and that. They need the basics. So, okay, provide them with that information, but provide it in a context that's useful. For example, there's a strong correlation between people who abuse anti-anxiety medications and people who have an underlying anxiety problem. Hey, go figure. So providing them with that little bit of information, that's useful. Providing them with information about alternative medications to benzos and alternative ways to cope with anxiety as opposed to just using benzos is helpful. Providing them information about nutritional practices that may increase their anxiety, that's helpful. Pharmacology does not just have to be about the illicit drugs. It can be about the alternatives to the illicit drugs, and helping clients understand that about neurotransmitters and about the fact that they've probably fried a bunch of neurotransmitters or neurons, and it's going to take a year or so for their brain to really fully recover from the substance use. This is a crucial piece of information that people need in early recovery, because the first year is more difficult than successive years because their serotonin levels are often depleted. They have difficulty seeing the world in color. It's all kind of shades of gray. And I used to use the analogy of Pooh Bear. Eeyore just kind of saw everything as in shades of gray. And for a lot of people, this is what early recovery feels like, because if they're not on the right medications and their neurotransmitters are out of balance, it's annoying to even hear me talk like that for long periods of time. Helping people understand that that's a symptom of the chemicals in their brain being out of balance, but it can be better. There are medications that they can take. There are natural things that they can do in order to increase their positive neurotransmitters and chemicals and reactions. That's helpful information for them to have. Make the class useful. In order to be persuasive, we've learned that you want to first help somebody identify that there's a problem. In pharmacology groups, a lot of times you're going to have people who don't believe there's a problem. So it might be useful to present some of the information about why this particular drug is a problem, but also presenting alternatives for using that drug for getting the same benefit. Addictions theory groups help the person understand where addiction comes from to the best of our ability, because we don't really know. But there are theories about why people use and how people use and stages of change. Help them understand these things. Help them identify where they're at in the change process. Help them identify characteristics of addiction within their family and different behaviors that they may do that are characteristic of addiction. This is not necessarily telling them that they're an addict, but it's raising their awareness that there might be a problem. Relapse prevention is obviously used later in the process, and this is not something that you would use with people in pre-contemplation or contemplation or even preparation. Relapse prevention helps people identify what's out there for me. What do I need to be aware of? What do I need to watch out for? Scenarios, role plays, group activities where they're brainstorming and applying information. I've always found it most helpful to spend the first 15 minutes of a group presenting information and then spending the rest of the group processing it and applying it and helping each client apply it to themselves and internalize the information. True, you don't get through lots of material that way, but in my opinion, it's more important to learn whatever you're teaching well than to teach a lot of stuff that's just going to be forgotten. Coping skill and defense mechanism training, helping people identify the difference between coping skills and defense mechanisms and the appropriate time and place for each of them. And finally, mental health awareness. We know that co-occurring disorders are the rule, not the exception. Enlightening people about the characteristics or the symptoms of depression, anxiety, and PTSD, providing hope that there are treatments available for these things and bipolar and schizophrenia and a myriad of other mental health disorders. And destigmatizing mental health, both by itself and in relation to, or mental health disorders, both by themselves and in relation to substance abuse. All of these things are helpful for opening the door for somebody to say, you know, I think I might have a problem and I need help. Skills development groups teach social skills, refusal skills, communication skills, and that includes listening, not just speaking, and anger and stress management skills through the use of rehearsal, role reversal, observation. And you can make these groups fun. For anger management, there were several times where we used clips from The Simpsons and had the clients watch it and say, okay, you know, Homer really flew off the deep end that time. What could you have done? What could have been done differently, and how do you think it would have turned out? Short snippets. Apply the information. Make it somewhat entertaining, because if people feel like it's drudgery, then they're going to be more tempted to sort of drift off. If they're kept entertained while they're also learning, it's a whole lot more helpful. You can also, in these skill groups, have them observe each other. Talk about what each other's doing as far as good things they're doing in relation to the group. For example, if you're teaching communication skills, you can have different members comment on positive communication skills that other group members demonstrated throughout the week. Another type of group that you'll run into often are cognitive behavioral therapy groups. They help people look at their thoughts, beliefs, decisions, opinions, and assumptions. Their thoughts, whether they're taking something and they're just blowing it all out of proportion, or whether they're minimizing it, or only looking at the bad, or only looking at the good. There are a lot of different irrational beliefs that people have that keep them in a dysfunctional way of life. You can go back and look at Albert Ellis's Irrational Thoughts and Aaron Beck's Cognitive Distortions and identify a lot of these different thinking patterns in addicted behavior. As I said before, the all or none thinking, the minimization, the thinking that everything has to do with you. If the sky fell, it's because of something you did. No, that's not true. Have your clients keep a list of these different irrational thoughts and distortions and identify ways that they have used those in the past week, and then have them write a healthy alternative. If they are one to tend to blow things out of proportion, have them give an example of when they did that, and then also have them explain to the group how they might not blow it out of proportion next time, and why it may not have deserved to be blown out of proportion. Cognitive behavioral therapy groups have a present and future focus. We're not concerned with the past and how you used to cope with things. We want to know about how you're coping with things in the present. How are you coping with things right now? What did you do? You can look a little bit at like last week. What have you done over the past week to cope? How are your skills changing? And how can you change for the future? What can you do next time to make it turn out even better? Some of the irrational thoughts. I must be loved or approved of all the time. Many of our clients can't stand to not be liked. It's just beyond them because their entire self-worth is based on others' approval or disapproval. Helping them take a look at that will help relieve a lot of stress in their life if they can accept the fact that other people have stuff and they're not going to be liked by everybody, and it may not be because of them. It may just be that person has issues. I must be competent at everything. Nobody's competent at everything. And these overachievers are setting themselves up for failure. They're setting themselves up to be disappointed and to feel stressed out. I am bad and must be punished. If you believe that, then you're probably in the wrong profession. People are inherently good, and they do the best they can with the tools that they have at any given time. If they make a mistake, they have to own up to it and maybe experience the consequences, but it doesn't mean they are bad. They are not a bad person. They made a bad choice. They did a bad thing. I must get my own way. This whole sense of entitlement runs rampant in society now, not just in treatment programs. Many people can't stand to not get their own way, and that's just not going to happen all the time. Whether we like it or not, we don't always get our own way. Helping people to internalize this and figure out which battles are worth fighting. When do you have to have your own way? Do you have to have your own way when it comes to what to eat for dinner? Is that a battle worth fighting? Do you have to have your own way when it comes to your children's medical treatment? That might be a battle worth fighting. Another irrational thought is that they have no control over what happens. True, there are some things in life that we have no control over. But we have control over some things. And differentiating between what we can change and what we can't change is a huge step. Anything scary must be avoided. Change is scary. So if anything scary must be avoided, then clearly treatment and recovery is not for you because it's scary. And if anybody tells you different, they're lying to you. But avoiding scary things doesn't make them go away. It just leaves them out there to grow or fester or come up and bite you in the butt later. So scary things, although they may be scary, oftentimes need to be addressed. Now, that doesn't mean you have to address them alone. And this is when we encourage our clients to rely on social supports. Have somebody to back you up. Have a cheering section. Have somebody go with you, whatever. It's easier to avoid life's difficulties. Well, that goes back to the scary things. If you avoid them, they don't go away. Oftentimes, like an untreated wound, they just fester and get worse. So it's easier to address it early, even though it might not be the most pleasant thing in the world. The past will always impact me. Well, to a certain extent it will, because everything that's ever happened to us has made us who we are, but we can choose to control how it impacts us. We can let it make us victims. We can let it beat us down, or we can look at the past and make positive choices and let some things go. By letting some things from the past go, it still impacts you because it makes you a stronger person. It has taught you how to let go of negative things. And finally, maximum happiness can be achieved by inaction. Well, I'd like to sit on my couch and eat bonbons and watch TV all day and be as inactive as possible. But that doesn't give me maximum happiness, except for maybe like 30 minutes, and then I'm bored. Humans need interaction. Humans need things in their life that give them pleasure. We need to have things that we're proud of. I'd be hard-pressed to find anybody that was proud of themselves for being able to sit on the couch and watch TV all day. That person is not achieving maximum happiness. Your cognitive distortions are the all or nothing. I've got to have everything that I ask for, or I don't want it at all. It's my way or the highway. Overgeneralization. Well, you didn't like the report that I turned in, so you must think I am the biggest stupid idiot in the entire world. No, just means I didn't like the report you turned in. Overgeneralization is another biggie, because a lot of clients came from addictive families, and they had certain coping skills thwarted early on, and they didn't learn to sort out the nuances of bad behaviors or bad products from being a bad person. Magnification of the negative. Well, if you feel like a failure and everybody's told you you're always worthless and a loser, then yeah, it makes sense to focus on the negative. In treatment, the challenge is to go back and look and say, am I a loser? And I would hope that you can help your clients identify the fact that they're not. They may have made poor choices, but they have contributed something positive to society. And help them focus on the positive things they've done, the challenges they've overcome, the good things in their life. Challenge them to maximize the positive and not ignore it. Just because something good happens to them, it's not just a fluke or a coincidence. Good things happen because you did good things. Jumping to conclusions is another one that gets a lot of people. If someone doesn't call, they will get extraordinarily upset because they feel rejected. Until you know why that person didn't call, there's no sense getting upset. Helping people to not jump to conclusions, especially not jump to negative conclusions that lead them into a downward spiral, is a huge challenge. Personalization. As I said, the sky fell because of something I did. Not everything happens because of you, and When you do something, not everybody notices it. Believe it or not, you are not the center of everybody's world. And it's hard for a lot of addicts to understand that they are not under a microscope all the time. And mental filtering, only remembering certain things, usually the negative ones. Help them see the good things and the bad things, the positive and the negative. Support groups can take a variety of different forms. The main characteristic of support groups is they are often not led by clinicians, but by other people in recovery. They can be problem and solution focused or emotional and interpersonally focused. They can be heavier or lighter on interpretation, but the goal is to provide support for one another through the recovery process. Interpersonal process groups focus on the present and help people monitor their own psychological functioning and how they're relating to one another and what they do in their relationships in order to create better relationships or in order to set up that self-fulfilling prophecy where people reject them or people go away. You can also help people realize how they repeatedly reconstruct their family of origin in different situations. Relapse prevention groups teach people to anticipate, identify, and manage relapse triggers, including people, places, things, and times or events. There's a host of other specific groups that are particular to your setting, including anger management, anxiety and depression, PTSD, medication compliance, communication skills, employment skills, life skills, depending on the level of functioning, whether it's residential or outpatient. Unfortunately, also depending somewhat on what insurance will pay for, you're going to have a variety of different groups. But as I said earlier, whatever kind of group you're doing, the more of the senses of each person that you can engage, the more retention you're going to have in your group. So you want to focus on making it enjoyable, making it engaging. A lot of people are going to groups after they've been at work all day long. So if they have something that maintains their attention, it's going to be a whole lot easier than if they're just sitting through the same old and being lectured at. Not everybody's appropriate for group, though. So make sure to screen your clients for people who are willing to participate in group. Or if you have pre-contemplators and you have to have them in a group setting, keep that group isolated from people who are motivated for treatment so they don't poison the people who are motivated and start making them turn into negative thinkers. Make sure your clients are able to honor group agreements. They can't be in crisis. They must be able to control their impulses and have defenses that won't clash with the group. You don't want to take somebody into a group that is extremely volatile, who gets angry, who lashes out, who's going to intimidate everyone in group. The whole impulse control, if they walk out of group and they're disruptive all the time, that's not going to be helpful. If they're in crisis and they monopolize group and it ends up being basically an individual session with 20 people watching, that's not effective either. So you need to make sure that the people in your groups are appropriate. And in your groups where you have pre-contemplators, again, try to keep it specifically for people in pre-contemplation or maybe contemplation, because you're going to handle that group much differently than you're going to handle a group that is already motivated for change. In early recovery, educate them. You want to provide knowledge, skills, and abilities. Provide the knowledge. Help them start learning about skills and provide support for them to internalize the knowledge and the skills and apply it to their own life. In the middle section of recovery, they're going to start really using those skills, solving problems, addressing their thinking patterns, and looking at their interpersonal processes and their triggers. In late recovery, they continue this process and focus a lot on relapse prevention. In pre-contemplation, use psychoeducational and cognitive behavioral therapy groups. Contemplation and preparation, you can use most any group except relapse prevention. Finally, in action and maintenance, all types of groups could be appropriate, including relapse prevention. So if you have somebody that comes into treatment in the action stage of change, they're ready to go, that doesn't mean you can skip over the knowledge part. They still need the psychoeducational groups. They still need to learn. But they can also have a much broader variety of options available to them. Now, we can't have a class on group therapy without discussing multiculturalism, because you're going to have diverse groups. The key is to be aware of any symbolism and nonverbal communication that is specific to your different cultures. Not all cultures believe that direct eye contact is acceptable. Not all cultures are comfortable airing their stuff in front of other people. So some people, some cultures, aren't going to be as receptive to group counseling. And it's important to be aware of that if your clients have to participate in group counseling. Being sensitive to their cultural values, and if they are from a culture that doesn't look kindly on telling everybody your business, not putting them on the spot in group and forcing them to do something that makes them uncomfortable. Provide them options for what to do. For example, they can write down their responses to a certain situation and give them to you after group. They can share as they feel comfortable. Cultural transference and countertransference is also something that you want to look at, and ethnic prejudice. Make sure that you are not communicating a sense of prejudice towards one culture or another based upon their ethnic heritage or their background. Don't assume the best or the worst out of anybody based on their age, race, sexual orientation, what have you. 99% of the time, you're probably going to be wrong. So you need to treat each person as an individual. Ask them. You can't just guess what's going to make them comfortable and uncomfortable. That's what the first phase of group is used for, is to talk about what are you comfortable doing, what are you not comfortable doing, and what are the rules for the group. There are two basic types of groups, fixed membership and revolving. Fixed membership starts on a date, goes a certain number of weeks, and ends. And the people that start the group hopefully all end the group, but nobody enters willy-nilly throughout the sessions. Revolving groups don't have a particular start or end date. People just come in, do their 12 sessions or whatever they need, and leave. But they don't have to start on any particular day. As I said earlier, groups form a little microcosm. They form a new social network. But in order to do that, they first have to form. And in the forming stage is when everybody asserts who they are, what they're comfortable with, they get to know one another, and you'll see alliances build. And that's okay as long as they're not destructive alliances. In the storming phase, you're going to have people vying for leadership and testing of group processes and norms. You're going to have people interrupting the group leader. You're going to have people sleeping. You're going to have people trying to get up and go to the bathroom. Just like when you had a substitute in school, people are going to test your boundaries. And that's what they're supposed to do. They're also going to test each other's boundaries. What can I say? What can I do? What buttons does each person have? Addicts are very adept at reading people, and they like to feel like they know, like they're in control, like they have the power to push buttons if they need to. During the storming phase, they're going to jockey for position. Who's going to be the group leader? Who's going to be the dominant personality? Who's going to recede into the background? And as group leaders, it's our job to try to maintain as much balance and equilibrium among participants as possible. During the norming phase, everybody's realized that, okay, we're all in this together, we're all equals. Now how are we going to come together and function? And it happens slowly. You have people vying for position and jockeying, and slowly the group will start to fade away from the troublemakers as they're perceived and develop their own norms and their own set of rules, and they will start to enforce it on one another. Most of the time, as a group leader, if you give suggestions at the outset and you set a clear set of rules at the outset, eventually when the group starts norming, they'll fall in line more or less with the rules. And if there's something that they find particularly distasteful for some reason, they'll let you know, and you can talk about alternatives to it. One person that I worked with, one counselor that I worked with in treatment, had a rule when she was doing her women's group. She had a little rubber duck that they passed around, and only the person with the duck could talk. I personally found that offensive, but the women in her group didn't have a problem with it at all, and, you know, more power to them. So, pardon me, that also helped them establish their own identity. They knew the rules. They knew only the person with the duck could talk. That prevented a lot of stepping on toes and talking over one another. Then they move on to performing. Once you have the ground rules established, it's time to get down and dirty and get to the meat of the group. And this is when the group becomes effective. Hopefully, they have really worked through the norming, and they are comfortable addressing each other and confronting each other. Because when you're working in a group and when you're doing hard work, there are going to be times that people need to be confronted. And there are going to be times when people need to respond to confrontation appropriately. During the performing phase, your group members feel comfortable enough to confront one another appropriately about their behaviors, about what they're seeing. Finally, you've worked through your things that you needed to work through in group. And you want to have groups be somewhat time limited because people don't want to think, you know, I could be in group forever for the rest of my life. 8 weeks, 10 weeks, 12 weeks, that's usually a good time to cut off and then reassess. At that point, it's time to adjourn or to let go of the group. There's a really good chance that the group members are going to see each other in the community. They're going to see each other at meetings. They're going to see each other in different situations. And that's fine and dandy. But they also have to be able to say goodbye to one another and to this particular setting. They're moving on. We talked about screening clients for their appropriateness for group. You also need to prepare clients for what to expect. Compare the group expectations to what's expected of them in 12-step meetings, and it's usually not the same. You need to emphasize that clients need to stick with it even when it's uncomfortable. Groups are not going to always be comfortable because there are multiple people there to call you out when you're making an inappropriate choice. Recognize the client's hopes and goals for treatment and help them see how group can help them get there. And again, give people in the early stages of forming a chance to express any concerns that they have. One of the greatest challenges for group is to keep people in through the whole 12 weeks or 16 weeks or whatever it is. The best way to do that is to be open and honest. Prepare them. Screen them. Don't just take people into group because you don't have anywhere else to stick them. That's not effective, and it's going to be detrimental to the people who are appropriate for group. Maximize client involvement. We talked about some of those examples earlier. Give them scenarios to apply what they're learning. Don't just talk at them. Use feedback. Provide them feedback about what you're seeing, whether it be good or bad. It's always helpful to provide people with information about what you're seeing. For example, I've seen really positive changes in you since you've been coming to group for the past 4 weeks. You're much more open. Or, John, it seems like over the past couple of weeks you've started to withdraw a little bit and you're less invested in group. I'm wondering if something's going on outside a group or if there's something inside of group that we need to address. Encourage attendance. One of the greatest ways to encourage attendance is to provide food and drink. If you've got the financial ability at your agency to provide coffee and snacks, you're going to have more retention than if you don't. Think of other ways to encourage attendance, and it's hard in adult groups to find a bunch of ways because many of the things that we do to encourage attendance can be seen as condescending. But do tell them that attendance is expected. Another way to encourage attendance is to let them know that they're going to be charged for group whether or not they show up. Money is an excellent motivator. Provide wraparound services. This addresses a lot of those obstacles to treatment. Transportation, child care. Sometimes you can provide a meal. Depending on your particular state, you might be able to provide a meal for people who financially qualify. And consider the time and length of the group. You don't want to have a 3-hour group that starts at 7 at night on a Wednesday. That's just asinine. Try not to have a group that starts at 3:30 in the afternoon because you're not going to have excellent retention from the people who don't get off until 4:30. If it's possible to work it out where you can have a group that convenes maybe 30 minutes after most people get off work, that's usually most productive. Just like going to the gym, if people get a chance to go home before they have to go to group, it's going to be a lot harder to get them back out the door and into the group room. So if they go straight from work to your group, that's helpful. But we do know that if they do that, they're probably going to be hungry. They're going to participate better and be more alert, etc., if they have something, even something minimal, to put in their bellies. Crackers, whatever your agency can possibly part with. The single most important factor to the success of your groups is that group members must accept the group agreement for expectations. If you've got someone who's a constant dissenter, someone who's constantly testing the rules, constantly breaking the rules, they're diverting focus. They're doing the addictive thing, and they're diverting focus from the real problem so they don't have to address the issues. That person needs to be gone. That person needs to either be an individual or in a different type of group, because you can't have them disrupting treatment for the other 10 or 15 people in the room. Keep expectations minimal and clear. Attendance, participation, behavior in group, confidentiality, the use of mood-altering substances, and financial agreements. It's all pretty simple. You need to show up on time, participate, act appropriately, maintain confidentiality, and not be under the influence. It's pretty much common. During each phase, there are certain specific tasks. During the forming stage, each member is going to meet one another. Everybody's going to be oriented to the group rules. People are going to air their anxieties and hopefully have those anxieties quelled and set the role of the leader. During storming and norming, the group members are going to jockey for position and try to figure out who among them is the group leader, at which point, without invading their space, you want to let them try to work that out in a healthy way, communicating with one another. Through this, you're going to establish the working conditions of the group. Help them understand what they have control over, what they don't, what's expected of them as far as confronting one another and receiving confrontation, and how to handle different situations as they come up. As the group comes together, they will start monitoring one another. If a group is functioning effectively, the group leader will not have to assume a parenting or an authoritarian role throughout group, because the group will sustain itself. Once you move into the performing stage, it's time to focus on content and process and encourage clients to identify mutual connections, mutual experiences, so they can support one another through the recovery process. Effective group leaders are consistent. They listen actively and they have a firm identity. They're not going to waver and try to side with one client, try to get approval from another client. They are who they are. They put their chips on the table. They're confident in their skills, in themselves, and in their own recovery, if that's a part of who they are. They can be spontaneous, because groups are never boring, and any time that you have a plan, it's going to get messed up. So group leaders need to be able to be somewhat spontaneous, but they need to adhere to a level of integrity so the group members know that they can trust that no harm will befall them. Effective group leaders are also empathetic. They hear with their head, they hear with their heart, and they help people do the next right thing. When leading groups, it's important to model effective behavior. Avoid role conflict, enforce the group agreement, encourage communication among members, but also to be flexible and aware when something might need to change a little bit. One of the biggest things is modeling appropriate behavior. And that's everything from how you communicate to what you communicate. Group leaders who suddenly turn a group into a show about themselves, where it ends up being more therapy for them than for the clients, that's a problem. By the same token, group leaders who are too distant and have absolutely no self-disclosure also don't model what we want to see in group. So the group leader needs to appropriately disclose whatever they feel is necessary, but not turn it into their therapy group. They also need to avoid role conflict. You don't want to be leading a therapy group if your sponsee is in your group. That could potentially be seen as a conflict of interest. You don't want to be leading a group if one of your employees is in it, or what have you. You can look at different things and judge for yourself. It's usually pretty obvious if there's a role conflict. But if you're concerned that there might be a conflict, seek consultation. Ask somebody whose judgment you respect if they think it's appropriate for you to lead a particular group. Other things that you can do to make your groups more effective include write main points on a whiteboard, on newsprint, provide handouts, assign subgroups to teach parts of the topic for the day. So if you're going over something, especially if you have a revolving group, and there's some people that have been through this particular session before, have them help teach part of it. Because one of the ways we learn best is when we teach, because it's not until we start trying to explain it to somebody else we really realize what we don't know. Provide handouts for people with learning disabilities or cognitive impairment. And you can construe that pretty broadly. In early recovery, there's a lot of fogginess. People aren't going to remember as much. So if they have handouts they can go back and look at when the fog starts to lift, it will be helpful. Chunk information. Teach it, apply it, rehearse it. As I said before, teach for 15 minutes, usually no more. You start losing people after about the 11-minute mark. Teach for up to 15 minutes, have them apply it, and have them role play or rehearse it, or do something else in order to manipulate the information in a way that's meaningful to them. And address any changes in behavior after group. If someone suddenly starts being disruptive or withdrawn or whatever, if there's a marked change in their behavior, it may not be appropriate to call them out in group. Part of it depends on the type of your group and how close-knit it is. But for a lot of these things, it's more effective to address it with the person after group, and then they can bring it to the group at the next meeting if they feel that it's appropriate. In summary, group types need to be matched to the client and the client's readiness for change. Group leaders need to have a clear vision for the group while still remaining somewhat flexible in how to actually make that vision come to life. But as we move into this era of managed care, groups are going to become more common because they provide a cost-effective adjunct to medication and individual therapy. And they can provide a safe holding pattern for people who aren't in crisis, but who need a higher level of care that is currently unavailable.